Children's Community Station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another episode of Healthcare Today with your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things relating to your health. And I have to say, it is like award ceremony in Cayman. I want to say congratulations to the team here. I'm going to let them introduce themselves, but I will say we're talking with our friends over there from the HSA Healthcare. And this has so much implications, but don't want to take the thunder. I'm going to let the ladies introduce themselves, and then we'll dive right into it.
Nurse Jennifer Miller. I'm a RN with the HSA department representing the district of Buntown, East End, and Northside.
I'm Nurse Yasmin Wheatle-Smith, registered nurse at the General Practice Clinic representing the district of Georgetown.
Hello, my name is Elizabeth Weber, and I'm representing the district of West Bay.
Thank you so much for stopping by here this afternoon, and congratulations on the Gold Award. Now, I have to say, being recognized in Cayman as the best is always great, but people don't know what you do till you do it. So walk me through the best home care service on the island, which is represented with you ladies right here this afternoon.
Thank you for the award. And we are elated and we are grateful for the opportunity to educate the public on the home care services offered by HSA island-wide.
And with that being said, explain the roles when it comes to delivering healthcare services. Everyone has an idea of what it consists of. But from your standpoint, what do you do and how do you do it as well as you do? Walk me through a little bit of that.
It's a multidisciplinary approach which incorporates many members of the healthcare team, which enable us to deliver the care to the patients in their home.
Exactly. And when it comes down to that, there's such a wide range of skills and also because when you think of home care, most people think, well, I take care of this at the home, but you bring a level of professionalism and also the medical side of it. A lot of people think of it home care as, I make the beds, I take care of the family, but you girls, you ladies do so much more. Walk me through the process of that as you have a client. Say you have a client in your district. What does that consist of?
Well, for example, if we have a client in the district who has been referred to home care, let's say, for example, that patient is diabetic, hypertensive, or may have a stroke, and they are discharged from the hospital. We go in and we make an assessment. After our assessment, we will coordinate the care according to the care plan and the needs of the patient. We will collaborate with the physician, the general practitioner, as well as the physiotherapist, dietitian, wherever the need arises. And after our assessment, along with the occupational therapist for equipment and whatever else the patient needs to create a holistic approach to the care of the patient. And we go in and do follow-ups as needed.
So it's a very specialized and very tailored service for each individual client that you have, because as you said, I may have hypertension, I may be stroke, and at the same time, maybe I am diabetic. So it's multiple problems that I'm having. You kind of tailor your care based on that.
Yes, and we tailor this care in the patient's home, so they're in the comfort of their own home.
Okay.
So the care is taken to them from the hospital.
Okay, so I know a lot of people, the back and forth to a hospital may be not conducive to a certain type or a certain problem that I may have, and so you really bring it into the home, into their environment, where they're able to see and manipulate it according with what you see with the doctors and the specialists based off of that. Would I be correct in saying that?
Yes, home care is provided to the patient once you have difficulty accessing the care at the health center or at the hospital.
Okay, so difficulties getting back and forth, right. Transportation problems. Yes. And some, I laugh, I said, people, we think Cayman is small, but it's very big. It may be very difficult for me getting from West Bay to downtown Georgetown to be at the HSA or even the Eastern Districts, or maybe even in town, maybe somewhat difficult for me to be getting up and down. So this is an alternative to that, and also give some guidance and also I want to say collaboration with the families and also the HSA. Would that be a fair assumption?
Home care is for stable patients. So it's patients that can be managed at home. Obviously, certain illnesses or chronic illnesses, they may have to go to town to see specialists, but then transport can be arranged for those patients.
Okay, so it's being stable at your home.
Yes, so we can provide home care, and our services are to try and prevent readmission into hospital so that they are maintained in their own environment where they're comfortable.
That's a huge departure from, I want to say, the days of old where everything was kind of subjected to going into, you had to go into the hospital. So you really expanded the hospital role to encompass these stable environments for the patient. Would I be right in that?
Yes, and some of the services we provide in the homes are like dressing changes. We do collection of specimens such as blood specimen, urine specimen. We monitor blood pressures, vital signs on a whole, and we do catheter change and so on. So all those things that patients would have to go either into their health center or into the hospital to have done, once they are stable and can be done at home, we provide that care at home.
Exactly. I was just going to ask about that, the different types of care that the home team provides. Can you walk me through a little bit of that?
Physician can refer for occupational therapy to do a home visit to assess the home. The dietitian can do a home visit to assess the nutritional needs and make sure they receiving enough calories and they're meeting their nutritional requirements. The obviously the GP does home visits. Each district has allocated time, date, amalgamated
That's right.
time for home visits.
What you do is go back 2 or 3 words and then read into it. So,
all right, sorry.
Yeah. That's fine. No problem. We're good.
So, for instance, in West Bay, our home visits for the GP is on a Thursday. So we have our allocated Thursday GP visits. And then once the GP has visited the home with the nurse, then situations can be discussed and appropriate referrals made to allow, for instance, home physio. So everything's tailored then for that individual patient.
Right. So there are different, I want to say, departments that come together to focus in on that patient's specific care to get everything rolling, to make sure that all of this is really, I want, and folks, but pardon my marketing towards understanding that patient and making sure that they have all that they need. So when the GP and those step away, it's already tailored for you ladies to kind of maintain and roll through with that.
The patients are also very involved in that care because it's not us providing their care. They have to be involved and participate. So it's a joint care plan.
I think that is really good because a lot of times when it comes to your health, you want to have as much say as you can. You want to be, and folks, don't laugh. You want to almost be in control, even though you're not. But you want to have a say in understanding what is going to be done and how things are happening in your circle. And I think this is a great way for people to feel empowerment and also feel like they have a vested interest. Because sometimes you go to say, okay, take these 10 pills and, we'll see you in 5 months. I'm exaggerating, but that has happened in other jurisdictions. And this is a very tailored, a very connected. So you feel like you are part of the process in building and taking care of your own health.
We also have the caregivers because quite a lot of time the patients are home with the caregivers. So we do try to educate the patient, caregiver, the patient, the caregivers, and their family members to enhance, improve patient care as well.
So wow, okay, I like that because what you're doing is also making family members involved because a lot of times, and folks don't laugh when I say this, people will be bringing you food and you'll be like, no, they can't eat that food. But if you don't know that, so as a broader outlook would be everyone being involved. It's on a low sodium diet, these types of things. It makes it, I would say, almost a family network within what you do. It's kind of an extended part to it.
Yes, so that's why as soon as we go in for an assessment, when a patient is referred to home care, one of the biggest part of home care is education. And we involved everybody, the family members, the caregivers, whoever is going to take care of that patient, the patient themselves. And we continue with education. Every time we go in for an assessment, for a review, we continue to top up on that education. We are there available to answer questions. They have access to us through contacting their health center. They just need to contact the health center and say to them, we are on home care, this is our name. Can you ask the home care nurse to contact us if they have a concern? And so we are easily reachable. So we continue to be a part of that care until the care is no longer needed.
Understandable. Folks, we're going to take our first break. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And when we come back, I'm going to ask the ladies what makes someone eligible for home care. So we'll be back in just a few minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care, comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m., we get together and talk about all things related to your health. And at this time, I've been telling you it's all about the awards and the wonderful home care service that the HSA has been offering. And this goes back for their Gold Award. And we have some wonderful ladies who literally are here talking about the districts and what it takes to keep our folks who are at home healthy. And it consists of so many different parts. Can you just introduce yourselves again for anyone who just tuned in?
Okay, I'm Nurse Jennifer Miller, and I'm representing the Eastern District, which involves Bordentown, Easton, and Northside.
I'm Nurse Yasmin Wheatle-Smith. I'm representing the District of Georgetown.
My name is Elizabeth Weber, and I'm representing the District of West Bay.
So we were talking just before we took the break about what makes someone eligible for home care. Of course, there's a lot of things, but the first thing I want to say is we know that they have to be stable. I get that, but what else does it consist of?
Okay, so for admission to our home care services, the clients must meet at least one of the following criteria. One, any age group with a medical condition or physical disability which prevents access to care at a medical facility. Mm-hmm. And two, if a patients that are discharged from hospitals with a referral for follow-up care at home. Clients must also further meet one of the following, which requires care that is within the scope of the home healthcare services provided, and the client is not a threat to himself, herself, or the caregivers. The home environment is not a threat or health hazard to our health team. Mm-hmm. Clients may also access the service by being referred by a physician or other health professional. They may self-referral.
Okay.
Yeah. And they may be also referred by the social services departments on our island. Family may also request for patients to be added to our home care services,
right.
Yeah, and also community members.
Okay.
Someone may go out and see the need and then they reach out to us. So
I think that this is a great, and I call it a team building effort, because it really takes a community to recognize, because sometimes you at the hospital may not see someone who is at home. So someone in the community, maybe someone from the church, maybe, knock on wood, a politician or someone of that nature who gets information, may say, hey, I'd like to refer this family member, this person, because I see they're having difficulty. And then you can go on in and make an assessment. It doesn't just have to be from the GP. It just doesn't have to be from the hospital. It can be anyone who sees a need and refers them back to you, which I think is a great. Speaking of that, if someone wanted to get in contact, I know we're in the midst of a show, but someone listening in, they may be running around. If they want to get in contact with you over at the HSA, how can they do that?
Well, you can contact the HSA at 949-8600, or in each district, you can contact each health center, Bordentown, East End, North Side, West Bay Health Center, or Georgetown Health Center. Or you can go into the health centers and request home care.
Exactly. So in all of the districts have access to the home care.
To the home care service. Just to explain that if you're living in West Bay, it would be your West Bay Health Center. And if you're living, whichever district you're living in, that would be the district that caters for your home care.
Okay. Yeah, it makes it real simple. That way it's someone in your, I say in your area.
Yes.
Someone who goes out. So I was talking to you ladies earlier and said, what's a typical day? We're talking numbers. How many people are in certain, I want to say home care? You said that there's some really busy areas and some things of that nature. Walk me through that. What's a typical day for you?
Well, I'm Yasmin, and I cover Georgetown area along with my colleagues from the General Practice Clinic. And our current home care list is 152 patients.
Wow.
A typical day, we would see 5 to 7, even up to 10 patients per day. We do go out in the morning. We prep, we pack our bags. We call it the hospital car, because that's our transport. So you will see the hospital car going to the homes. And we prep and pack our bags based on the assessment of the patients and the needs of the patients on that day.
There's a lot of prep then.
Yes. So sometimes the prep is overnight. Sometimes we have doctors who have ordered fasting blood tests. We actually do home care on our way to work.
Wow.
Sometimes. So we'll go to the patient's house very early.
Before you even get in
Before we even get into work. And then after we see the patient, we go back into HSA and document. And then we make preparation for the next day, and we follow through with referrals throughout that day. And it's after we go in, sometimes we will answer messages, add other persons, make arrangements, phone calls, and so on. And that would be our day.
That's a busy time, and also lots of planning. There's a tremendous amount of teamwork and planning and prep involved to make this happen and make people feel comfortable. Because when you're going in, a lot of people may be squirmish about needles, they may be squirmish about fasting, all these things, and you come prepared to deal with all of that.
Yes, it's a lot of planning, but it does take off some of the stress off the patients because they're in the comfort of their own home. So even with blood draws and you're afraid of needles, we would make an assessment and see what's the best size needle we can use in the home setting.
Right, exactly. And I think that's a great way to also make a person comfortable. I mean, a lot of times people, even me, who's probably lived at most hospitals in and out all my life, but I still get nervous about walking into that for whatever. It could be kids, so to know that some family member or myself could be at home care is a great advantage.
Yes, but with over time, after the patient is added, and you have visited a few times, they are familiar with you, so they get a bit comfortable. So then it's easier for you to provide the care. They are very comfortable with you providing the care in the home setting.
Exactly. And I wanted to shift us a little bit for long-term care. We've talked about stuff in the intermittent, coming out of surgery, things that I would be building back, but long-term care. Walk me through a little bit through some of the long-term patients and things of that idea.
When they're assessed, you know that they're going to be a long-term care patient. Mm-hmm. You can discuss with the family, with the doctor, how often they're required to be visited on a regular basis over a length of time.
Right.
Which is then established. Then if there's any issues that arise, the family usually come into clinic or will phone me in clinic and say, oh, can we come and visit this week because such and such, we have an issue.
Some complication
or something they're concerned about. So then we will schedule them in.
So there is emergencies, stop-ins and things of that nature?
Absolutely. Patients' families will phone and say, or for instance, also we have a dentist in West Bay and she will make home visits. So they may say if it's an elderly patient, yes.
Okay.
There is a criteria.
Mm-hmm.
But then if someone has some issue,
wow, I wouldn't have thought of it. Now that you brought that into it, and folks, this is just my thought process. I wouldn't think of something as dentistry as an emergency, but if I'm invalid and I'm homebound mm-hmm. and I can't get there, I guess that would be an assessment that they would have to need to do. Well, that's really great.
And so is offered in the Eastern Districts as well.
Say again?
That is offered in the Eastern Districts as well.
Okay, awesome. That's really, once again, folks, if you don't know, you don't ask these questions. So it's really great that you ladies are here to answer these questions, because things of that nature, if I have a wisdom tooth that's paining me and I'm homebound, what do I do? So there is relief in that department. Mm-hmm. That's really great to know.
Yeah. So the dentist would then sort of make their assessment and then plan for the treatment, obviously in the appropriate setting.
Mm-hmm, right.
But the patient is then assessed in their own home where they're much more comfortable.
Really, that's really great to know. I mean, and this again, folks, if you're just tuning in, we're talking about the home care services. They're recognized as a gold award winner as the best in Cayman, and just having an honest and impromptu conversation about things that their daily challenges and things, how they manage patients and such. I mean, one of the things I think is what you have done is build a very strong relationship with the families. There's always, you can't be everywhere all the time. So being able to have access from the families to you, and you're able to access through the HSA, I think that's really great in bond building.
It is, and also we have other, obviously health providers on the island, and if a patient has had a surgery elsewhere or been overseas, the family can come in and say, we've been discharged, we've just landed back on island, we've had this procedure done. They usually have copies of their notes, and then we can plan a home visit. But they're not well enough yet to come into clinic,
right.
Don't feel strong enough. We can then make a home visit and make an assessment.
So it's really across the board, whether it's, and I want to say in-house with HSA mm-hmm. or outpatient of mm-hmm. some sort, mm-hmm. there is still that accessibility for home care services.
Yeah.
Yes, there is, but remember that we would have to get access to the medical records if it's an outside
Right, it needs to be transferred so that you guys...
HSA, mm-hmm. Yes.
And I think, I laugh about it, but that makes perfect sense, because you need to know what you're taking a look at, what you're walking into, what this procedure or what this person needs are. You can make the assessments once the paperwork has been transferred over into the HSA realm. I think that's really great. And I think that's part of our community network. And I mean, Cayman is quite small, but I can't remember having this services anywhere in the U.S. and things of that nature. If you didn't get there, you didn't get there. You had to call an ambulance service, and that was it. If you were 15, 20 miles away, you get there how you get there, rather than them coming to you and giving you this very personalized service. And this is all done through the HSA.
HSA look forward to bring in the care from hospital to the patients in need. We want to provide the same care that is provided in the district health centers. And so this is why this service is provided to the patients at home.
Exactly. So, folks, we're going to take our second break. When I come back, we're going to talk about the challenges that the teams face in delivering home care and how they overcome. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m., we get together and talk about all things relating to your health. And today we have with us our home care services who have been recognized as a Gold Award winner right here in the Cayman Islands. We'll be back in just a few moments.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and a Saturday, we get together and talk about all things related to your health. And this time, we're talking to the wonderful ladies from the healthcare services. They have been recognized as Gold Award winners and talking about the best home health services on the island. And before we got out of here, I wanted to talk about also some of the challenges that happen when you are administering home care, and also things that you have witnessed, and kind of putting people's mind at ease to understanding what it is that you do and how you work as a team and overcome.
Well, some of the challenges that we have in providing home care is that patients have the need, but they are afraid to have us as strangers come into their home because they may think that their home is not conducive to invite strangers. Mm-hmm. However, we are not there. We are not there to judge you or see how you live or see how you live or anything like that. We are only here to bring the service, the healthcare service from the hospital to you. So if there's also the question of financial support, are they able to afford home care? Mm-hmm. We will direct you. We'll make an assessment and we will direct you where to get information regarding financial support and how we can continue the care.
Exactly. And I know for a fact that the team has never turned away anyone from home health services. So that means that whatever issues that people are hearing or thinking about, there's an answer. There's a solution to it. We just need to come together and work towards the right one.
Yes, and home care can also be provided based on the patient's desire. Mm-hmm. So if, for instance, you do not want us to come that often because you're self-pay and it's expensive, you feel like it's expensive, then you can arrange with us to say these are the times when you actually want the visit. So you have that option of requesting the visit whenever you need.
It's as you said earlier, it's very much based on need and assessment.
Yes.
And if you realize that someone needs less, then that's fine. We're willing to understand and work with that. And if somebody needs more on a medical level, then you provide that also. We talked a little bit about this, but I want to just kind of come back into managing the transition. Say I just toss it out there. I did a procedure at the hospital, and now I'm making that transition from being in HSA, and now I'm heading home. That transition, that care, ensures the continuation of the care and the patients and my safety. Walk me through a little bit about how that works.
Right. Well, if you've been an inpatient, a discharge summary will be sent to the relevant district with the information of what procedure you've had done or what treatment you've received, along with your medications, your next of kin details, and where you live. We will then contact within 72 hours. We try to do our best within 72 hours to make an appointment to come and see you at home. Mm-hmm. Once we've visited, if a GP needs to make a visit also, then we can make that assessment and arrange for the doctor's home visit. Whether you need the occupational therapy to make your home a safer environment to keep you at home.
Okay. So you do that assessments as well?
The occupation, yes, safety. Absolutely. Okay. She comes out and makes assessments with regards to if you're a bedbound patient, whether you need any lifting help,
right?
Specialised equipment, or whether bathroom rails, raised toilet seats.
Reality, yes.
Yeah. And then, so there's lots of things we do on that first initial visit to try and keep you at home, make you more comfortable.
When you think of, I had a procedure and I'm heading home, I was able to move 100%. Now I'm at 45, 30%. Now I need help getting out of bed. Maybe my bed is too low. Mm-hmm. These are things that are real concerns that I may not see at the time, but occupation may come in and take a look at it and say, hey, let me make a recommendation. You need this. You will need a walker to get from, say, bed to the restroom or wherever, or maybe it's too far. Maybe you need to change rooms. Maybe you can't be accessed because, I live by myself and I'm in the back, whatever the case may be. So these are real life scenarios and situations that you take a look at. And also like changing gauze and things of that. You take an assessment into that also.
We do provide dressing change in the home setting, and we make referrals accordingly. So if based on our assessment you need to be reviewed by the surgeon, then we will make that referral for review by the surgeon based on our assessment.
I know numbers are very important, especially with how big our island has grown over the last couple of years. Tell me a little bit about the numbers that we have as it relates to home care services.
Okay, for the district of Bordentown, we currently have approximately 100 home care patients. Our GP doctors does home visit on a Tuesday, and the nurses tend to go out just about every day, Monday to Friday as best as we can. For Northside, they have 25 home care patients, and Nurse Nardia Henry is the registered nurse nurse there in Northside. East End have 31, and Nurse Lynn Swan is the registered nurse for that district.
Excellent, excellent. And I mean, I think that the numbers show the commitment to the department and also how much people are in need in specific districts.
And for the District of Georgetown, we currently have 152 patients. We do have our physician going out twice per week. At least 4 patients are seen on each day, as well as we have our nurses. We have a dedicated nurse to home care every day from general practice clinic, as well as support from the other nurses in the clinic.
Wow, that's really, really good. And I'll just ask the numbers for my Republic of West Bay. I just tossed that out there.
We have approximately 90 patients on the list, and with our GP doing visits on Thursday. I work in the clinic in the morning and do home visits in the afternoon, but often receive support from GP. Nurses will come up and assist and help with home visits.
Okay, and we also have other RNs and registered nursing assistant personnel who assist with the home visits in Boddentown. We also have our regular clinics, that GP clinics, dressings and stuff that is being done, and then we incorporate going out to see the home care patients.
Exactly. A well-oiled machine and lots of moving parts, but getting it all done.
Just to let the public know that our home care patients are seen by the physician between every 3 to 6 months. So at least twice per year, each home care patient is seen by a general practitioner. And they have their routine blood tests done prior to each visit. So the service provide blood test before doctor's visit, and doctor's visit at least twice per year. Minimum.
Excellent. Exactly. So as I said, this is a really great service for us to have in the Cayman Islands. And also, as you said, patients and families, if you need to learn more information about this, I said about this earlier, but I just want to kind of emphasize the importance of our healthcare system and our home care services, and giving them the information on how they can reach out to you, whether they need to send it to the GP or maybe make the phone call. How can they reach out to you?
You can contact your health center, as well as you can contact the hospital, and they will direct you to the health center. You just need to inform them of which district you're in, because home care services are provided by the nurse in your district health center.
Yep. So it's really, really depending. So if I'm in West Bay, I reach out to West Bay. If I'm in the Eastern Districts, I reach out to that. Or if I'm in Georgetown,
you reach out to general practice.
General practice. Ladies, thank you so much for being here. And before I get out of here, I just want y'all, because I didn't say your names, go ahead and say your names, who you are once again, and what you do, because I just want to say kudos to each one of you and congratulations on your award.
Okay, I'm Nurse Jennifer Miller, and I represent the district of Boddentown, as well as East End and North Side.
I'm Yasmin Whittle-Smith. I'm a registered nurse in General Practice Clinic.
I'm Elizabeth Weber, and I work at West Bay District Health Center, and I'm the registered nurse there.
Thank you, ladies, so much for stopping by and having a conversation with us. Kudos to the team, because I know it's a big, vast network, and you ladies represent them. So thank you so much for stopping by here this afternoon.
Thank you for having us.
Thank you.
Keep it right here. This is Chuck Taylor. We get together each and every Friday and Saturday at 1 p.m., and we talk about all things related to your health with healthcare today with the HSA. We'll see you soon, K-Man. Be good to one another.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location is state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
This is Rick, your old-time radio host. Join me Saturdays at 8 p.m. as I bring you the best of classic radio shows. These are the programs your grandparents would listen to that made them laugh, gasp, and sit on the edge of their seats. We'll hear crime dramas, bone-chilling horror, thrilling science fiction, action-packed westerns, side-splitting comedies, and more. I'll transport you back to when radio was king. Every Saturday at 8 p.m. only on Bobo FM. Let's relive the golden age of radio together.
Cayman's community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
Today on Be Well, Be Healthy for Life, Lady K helps us prepare for hurricanes with our health in mind.
We all look forward to summer. Here in the tropics, that means more beach days, pool parties, family trips, and sadly, hurricane season. Now, we all have painful memories of hurricanes, but preparing for hurricanes is just a part of our routine. Making sure we have adequate supplies of non-perishable food, paper goods, and water stored is just a part of the drill. But there should be more to your hurricane preparations. The health-related items that are often forgotten until we sometimes need them. This hurricane season, don't get caught without critical supplies you may need to safeguard your health. Take inventory of your first aid supplies, bandages, cotton swabs, antibiotic and antifungal creams, alcohol swabs, painkillers, and other first aid supplies can be very important in the aftermath of a hurricane. It is easy to get injured while you're shuttering your house before or you're trying to clean up after a storm. Broken glass from a shattered window or maybe loose debris can cause cuts and scrapes. And please remember, avoid standing water. There are many unseen dangers such as ringworm and other fungi, as well as a variety of bacteria that can lurk below murky waters. It's helpful to have your first aid supplies already on hand, so stock up before the storm. Be sure you have adequate supplies of your prescription drugs. You want to fill prescriptions when they're due, and then talk to your medical professional about your prescription drug supplies. You want to ensure that if a hurricane does threaten or hit, your health is not affected. Remember, power outages, flooded roads, and many other conditions may prevail after a storm. Stock up on healthy, non-perishable food items. Very often, the non-perishable food in our hurricane stocks are all canned meats and snacks that are loaded with salt and preservatives. Now, canned meats and, such as corned beef and canned soups are quick and easy to prepare during and after a storm because they can be eaten straight from the can or they need very minimal cooking. I understand. But these items have a large quantity of fat and salt, which are bad for your health. So canned sardines and mackerel are a better choice because these are dark fish which have high protein and omega-3 fatty acids. Nevertheless, they too can contain unhealthy quantities of sodium. So please, take the time to read and compare labels. The same goes for canned fruits, juices, and vegetables. Read the labels carefully. For canned fruit, choose those that are packaged in natural fruit juices without any added sugar. And then for canned vegetables, look for ones that are packaged in water instead of brine, which is super salty. Choose 100% natural juices if you can. And if that's not possible, then choose the ones with the lowest possible sugar content. And also consider diluting them when you're drinking. As a general rule, when you're buying canned goods, always look for foods that are low sodium with no added sugars. These will be much healthier for you and your loved ones to eat while you try to ride out a storm. Let's talk about hurricane snacks. Everyone's favorite part of the hurricane supplies is the snacks, right? But instead of chips and sweet biscuits, consider some healthy snacks, such as dried fruit, nuts, and protein bars. But once again, read the labels. Even dried fruit can sometimes contain added sugars. And because dried fruit typically contains a larger concentration of sugar, this is caused, of course, by the dehydration process, you really have to be cautious. Nuts are always a good bet. And protein bars can be filling, and they offer sizable nutrition in small quantities. Hurricanes are a part of living in the tropics. We sadly can't avoid that threat that often looms over our islands. But what we can do is to be prepared as best as possible. So this hurricane season, we truly hope we can escape being hit by a storm, but let's still prepare with our safety and our health in mind.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.